Aloha. I'm Dr. Catherine Taketa-Wong. My mission is to heal the sick, not just to give them pills to take for the rest of their lives. And I'm very happy to welcome Dr. Christine Williams. She's here with us today. She is the newest member of our practice, and I'm very, very excited to have her here with us and to share all of her expertise and her clinical knowledge. And as naturopathic doctors, we can write prescriptions for drugs, but we would rather write them for herbs and for healing foods. And also, as Chinese medicine experts, we can employ a whole different approach to health that complements our Western system. And as a healer, our mission is to educate and empower as many people as we can about how to become healthier and happier. Happy people, happy world, right? So my specialty is the medical treatment of autism, ADHD, and other special needs. And I also treat some of the toughest adult conditions. We don't take new patients without a phone consultation. So the contact information is on our Facebook page. At today's event, as I mentioned, I'm very happy and just really excited to be able, as I mentioned, to introduce Dr. Williams. Dr. Williams is a licensed naturopathic doctor and acupuncturist. She earned her Doctor of Naturopathic Medicine and her Master of Acupuncture degrees from the University of Bridgeport in Connecticut. After medical school, Dr. Williams was diagnosed with endometriosis, which is a very painful condition having to do with female hormones that caused her to miss time and work with friends and family. Fortunately, Dr. Williams' naturopathic training led her to seek practitioners who treated her using naturopathic medicine, acupuncture, and high-quality supplements and herbs. Although the condition is chronic and doesn't resolve until menopause completely, it is now under control. And her experience inspired her to specialize in women's health and hormones, an expertise that she now brings to our practice. So again, welcome. Thank you for joining us, Dr. Williams.
Thank you, Dr. Taketa-Wong. I'm excited to be here. So yeah, unfortunately, endometriosis for many can be a struggle to get the diagnosis, but I am really grateful to my naturopathic training because I was getting nowhere with conventional medicine. And one day it clicked and I realized the pattern and the diagnosis, even after seeing many gynecologists and ER doctors. And if I were not a medical provider, I may not have known and be able to come to that conclusion of endometriosis on my own. Yeah. So now I want to help women who are struggling with their health and hormones to heal, who also may not be getting the answers and solutions that they need. Yeah. I would like to prevent that pain and frustration that I had to endure, and I know many women are.
Yeah. A lot of women, right, that come to us and they're just like, I have all of these symptoms and I'm dealing with pain, or I have whatever it is, X, Y, and Z. And I feel like my doctors aren't listening to me. I know that both you and I have had, unfortunately, a lot of patients that have come to us sharing that story, right? And so I think that's a big thing is, really taking the time to listen, because patients know their body, right? They know if something's not right. And I know we've both had a lot of patients over the years that they've basically been written off or been told by their doctors, oh, you're just crazy, it's in your head. Or, they're like, yeah. They run a few tests, they can't find anything wrong. And so they say, it's all in your head, right? Yes. And so I think that part about listening to patients and really, I think our message is that we want women to know that there are answers and remedies that can be extremely effective for treating many hormonal conditions, many different women's health conditions, and have to just suffer or, use painkillers and that's the only option, right? There are lots and lots of other options.
Absolutely.
Yeah, and since women's health is your specialty, can you share some of the specific conditions that you've treated in this area?
Yes, I've treated anything to do with a hormone, but in particular, I treat endometriosis, PCOS, fibroids, estrogen dominance, irregular periods, absent periods, PMS, perimenopause and menopause, and all of their underlying conditions as well. So they might be connected to thyroid conditions or adrenal insufficiency. So anything to do with hormones in women's health.
Yeah, thank you. And can you share with us, Dr. Williams, a little bit about how the naturopathic and Chinese medicine approach differs from the conventional medical approach when it comes to treating women's health conditions in general?
Yes, I think this is an area that naturopathic medicine and acupuncture and Chinese medicine can really shine. In general, naturopathic medicine and Chinese medicine seek to understand the root cause of your symptoms and then create harmony in the mind and the body. They both believe that the body is inherently wise, and it's our job to give the body what it needs to heal and to remove any of those obstacles to healing. Conventional medicine, especially for women's health, often the only tools available are synthetic birth control and or surgery to remove reproductive organs, or something like a fibroid or endometriosis lesion, for example.
Mm-hmm.
But a lot of people don't want that to be the go-to treatment for their hormonal issues. I know I didn't. And oftentimes the issue isn't in the ovaries or the uterus, but something deeper. And when we treat that deeper issue, we see health and symptoms improve.
Yeah, yeah. And could you give just, I mean, there's a lot of different conditions, right? But you talked about, so if you could just share in general, what are maybe a few of some of these underlying conditions in women's health conditions in general? I know you shared earlier, you mentioned thyroid, right? So that's one possible underlying condition. But what are some of the other underlying conditions or contributing factors that you see with many of the patients that you treat that often, I guess I would say, is often not really looked at or not tested for in conventional medicine?
Yeah, I think there's quite a few. The first ones that come to my mind are, the food that we're eating. Oftentimes our food isn't the grown the way it used to be traditionally grown, and we're getting these environmental toxins. So I always talk about diet with my patients and what nutrition that they're deficiency. It could be something to do with their thyroid, and or stress. Stress is a big underlying component of healing. And so we always talk about that as well. And, the systems that we live in this world, for women in particular, we have some things working against us that we often have to overcome. So we have another layer of stress added to our lives. So I talk about that and trauma as well, which can often be an underlying cause for imbalances.
Right, yeah, so definitely. And toxins too. I mean, sometimes we see patients that have high levels of toxins like heavy metals or herbicides or pesticides, and many of those are known to cause hormone imbalances, but then they're never tested for, they're usually never looked at in conventional medicine. And so I think that's another big area that, it's really looking at the whole picture, right? And like the question is, okay, if you have this hormone imbalance, sure, you could take hormones to correct it, but why do you have that hormone imbalance in the first place, right? And so I think that's where I think naturopathic and Chinese medicine really shine in terms of really trying to figure out, okay, what are the root of the issues, and how do we address the root of that, right? So
Exactly.
yeah. And let me see. So, before we move on to more detailed discussion, let me see. I wanted to just let people know that they can. I want to let everyone know that people do call and talk with me after viewing a video or two, or visiting our website. And then some do become patients of either myself or Dr. Williams or our other associate, Dr. Anderson. So you're welcome to schedule a no-charge phone consultation with me for any of you who are viewing this video and want to discuss your health concerns or see how we could help. So all the contact information is on our Facebook page. And also please remember to visit our online supplement store, which is on our website. It's at drtaketa-wong.com. Our prices are very competitive, and all of the proceeds go to helping children with special needs with their medical treatment. So there's a link in the post with this video. So Dr. Williams, kind of going back to our conversation, having gone through what you did, let's talk about how conventional medicine approaches treatment for endometriosis compared to naturopathic medicine and acupuncture. So could you talk a little bit about that in regards to endometriosis specifically?
Yeah, absolutely. So endometriosis in particular, the options that you do receive are birth control to suppress the hormones and the communication between the brain and the ovaries, and as well as excision surgery of the lesions or hysterectomy. And even a hysterectomy doesn't guarantee that it will not return, and it does not guarantee that you will be pain-free. With naturopathic medicine and acupuncture, we aim to balance the mind and the body. And if we don't take that into consideration, we allow the same internal environment to continue and the same state in which the endometriosis grew. And if we believe that symptoms are signs from the body that something's out of balance, our job is to return to that balance or that homeostasis. Surgery and birth control may be part of your treatment plan, but even then, naturopathic medicine and Chinese medicine can be extremely helpful in preventing it from growing back and supporting the healing process. So I believe that there is no wrong treatment plan if that is the right treatment plan for you, but naturopathic medicine and acupuncture really has a place in any type of treatment plan for endometriosis because it is so multifactorial, and I think we'll learn more and more about endometriosis as more research is being done. But from what we know now, and I think Dr. Taketa-Wong, your experience in clinic and my experience in clinic, we have to get to that root cause, and we have to help with the inflammation and the immune system and really get a grasp on endometriosis so that we don't have these women in pain for every single cycle of their periods.
Right, yeah. And I just to back up a little bit in endometriosis, can you share a little bit about like what is endometriosis and what are some of the common symptoms that?
Yeah, so endometriosis is when we have endometriosis. The inner lining of the uterus grows outside of the uterus. So we have these growths that grow, that are supposed to be growing inside your uterus, that are growing outside. And as your tissue thickens with each cycle, getting ready to have a period, that where those lesions are outside of the uterus become very painful. So one of the first signs of endometriosis is painful periods. And that may look like very severe pain. And I'll present a case in a little bit, and that patient presented with 20 out of 10. So 10 out of 10 being the highest, she presented with 10 out of 10, 20 out of 10 pain. And so you can get scarring and what's called endometriomas, and it becomes irritated and it's very painful. You can also have very heavy periods. You can have pain with sex or bowel movements and urination, and infertility as well.
Yeah. So let's go ahead and move on to a case. You have a case of a patient that you treated, and I think it would be useful to discuss the specifics and how you handled it so that our viewers can have a better understanding of naturopathic and Chinese medicine compared with the conventional approach. So could you go ahead and share that briefly of the patient that you worked with?
So I had a 30-year-old woman come to my office looking for help with her debilitating periods. It had been happening over the course of about 4 years. And like I said, she mentioned that her pain was 20 out of 10 with each and every period, with intermittent pain in her lower abdomen outside of her monthly cycles. So even while she wasn't bleeding, she was having some pain. She had to take ibuprofen every day during bleeding to be able to go to work, and she was still uncomfortable. She had tried oral birth control pills that were prescribed by her gynecologist, but she did feel worse on them, and they did affect her mood, bringing on depression and anxiety. Her gynecologist did suggest seeing a specialist to remove those lesions inside and outside of her uterus, but she joined a Facebook group for people with endometriosis, and she realized that that surgery would not be a cure. So she was hesitant to go ahead with surgery. She did know that she had major stressors in her 20s that she felt were unresolved, and some other symptoms that she told me about were just some overwhelming fatigue, mood changes. She had acne before her period, carbohydrate cravings, breast tenderness, and heavy bleeding with clotting. She also did experience pain during sex, and she did want to preserve her fertility for the future. She slept really, really well, but she was just not feeling rested. And some other things that she did try were yoni steaming, birth control pills. She was on a multivitamin, and fish oil, but she just wasn't getting the results that she wanted. So after talking to her and doing some testing, which is often the first step, her test did show she had high estrogen, which can lead to some of these symptoms, and it has a really big role to play in endometriosis. And so she had a high estrogen, mildly elevated testosterone, so just above the limit where we want to see it. And her stress hormone, the major stress hormone cortisol, was very low, lower than normal. And so because endometriosis has hormonal, immune system, and an inflammatory component, we did need to work on each of those. And I take a whole body system approach to my treatment plan. So we did start with bioidentical progesterone, and that helps to balance out the estrogen and the testosterone. It also helps to regulate cycles. It also, when we take it orally, it can help with mood as well. So helping us feel better, less stressed and less anxious, and help sleep better. I added in an adrenal support for that cortisol and for her stress that she was experiencing, with certain herbs and nutrients. And we did some lifestyle modifications. So she was working herself to the bone with her workouts. So we incorporated slow, gentle exercising so that she wasn't contributing to her fatigue and inflammation. So we did long, slow walks and restorative yoga. We added that to her weekly routine. And we talked about diet. So we did a food elimination diet, and it was found that wheat was inflammatory for her. So we limited her gluten intake. We also took out any estrogen mimickers. So these things that in our environment that can make us have high estrogen, and some of those things are plastic that she was storing her food in and eating out of. So we got rid of all the plastic in her home that was coming into contact with her. Weekly for 2 months, and then every other week for 2 months, and now she is coming monthly as needed. I did two referrals. One was to a pelvic floor therapy and for talk therapy to help support her cortisol and her nervous system. After 2 months, so she did really great. She did as much as she could to stay consistent. And after 2 months, her periods did get a little lighter on her skin. By 4 months, we had seen a decrease in the severity of her pain from the 20 out of 10 that we mentioned before to 7 out of 10. And she was even getting some cycles with no pain. So we took this as a sign that things were improving. And throughout her first year of treatment with me, now she has bearable periods that she is able to manage on her own. Her energy is improved, her skin and her moods are improved, and she's coming monthly for acupuncture and as needed when the stress builds in her life. So this is just an example of how when we give the body what it needs to heal, remove the obstacles to healing, the body responds in a really positive way. And that was without birth control or surgery, which a lot of us are seeking.
Yeah, yeah. So that's great, and it's just it's so exciting and so rewarding, to be able to see patients who are getting better, and it's just like, wow, I know that that's why both you and I do what we do, because it's just so rewarding, incredibly
Yes.
rewarding to see patients getting better, and without having to use drugs and surgery, or not that we're opposed to drugs in
Right.
all cases, right? There's certainly a time and place, but many of them have a lot of side effects, and so a lot of patients, come either on a number of pharmaceuticals and they want to try to wean down or wean off of them, and so we do that with a number of patients, and many patients, depending on their condition, of course, but many of them will be able to wean off of medications and are feeling even better than they did when they were sometimes on the pharmaceuticals, right? So, yeah.
Yes.
Um, so that's great, and thank you so much. So, for our viewers, I trust our discussion about women's health has been useful for you. You're welcome to talk with me personally about any health concerns that you have, so that you too can feel empowered with your health. All the contact information is on our Facebook page. 30-minute phone consult where we talk with you about your health concerns, and then you could see Dr. Williams, or myself or Dr. Anderson. But again, Dr. Williams really has a lot of the specialty in women's health. And so please remember to also visit our online supplement store, which is on our website at drtaketa-wong.com. Our prices are very competitive, and all the proceeds go to helping children with special needs with their medical treatment. And a link is in the post with this video. So mahalo, and we look forward to seeing you in 2 weeks. Aloha.
Thank you. Aloha.